Hello and welcome to our today's HeadApp webinar. I'm Ferry Tomacek, CEO of Neurozip, the company providing HeadApp internationally. I'm delighted to have you join me as I share knowledge about cognitive rehabilitation with HeadApp. This webinar has been pre-produced as a video. At the end of the webinar, I will be happy to answer your questions. Please write them to me in the chat box. In this webinar, you will be introduced to HeadApp, learn more about its distinctive features, along with how to implement the program in a rehabilitation setting. The webinar will have two parts. In the first part, I will give you a brief overview about HeadApp's therapeutic approach, the features and advantages. In the second part, I will introduce you to the ease of use in the software themselves. If you are looking for the most effective care for your clients, we are convinced you will like the evidence-based, clinically proven and very simple to use HeadApp system. HeadApp is the professional's choice for computer-aided cognitive rehabilitation and offers class-leading performance for clinics, practices, rehabilitation centers, mobile use and in-home rehabilitation via internet. The system provides deficit-specific, highly effective therapy for patients with cognitive deficits resulting from stroke, TBI, inflammatory and degenerative diseases, or cognitive deficits associated with psychiatric diseases. Based on the science of neuroplasticity, it targets both restorative and compensatory training for identified areas of cognitive weakness. HeadApp addresses memory, working memory, attention, reaction and impulse control, planning and problem solving, spatial cognition, language, and everyday functions. HeadApp provides both an in-clinic solution and a telerehabilitation solution for home patients. The web-based application can be used on any internet-enabled computer, laptop, or tablet. The system provides 7 screening tests and 2 questionnaires. The screenings are designed to assist the therapist in finding the most appropriate therapy modules. They can detect which cognitive deficit the patient may have and which degree of severity can be found. The system automatically recommends therapy modules most suitable to address the specific cognitive deficits of the client. 23 computerized therapy modules are available to help your patients improve cognitive function and compensatory skills. The programs offer a wide variety of cognitively stimulating activities and cover all cognitive domains plus language. The programs can be personalized so that each patient gets an individual therapy to meet specific needs and challenges. HeadApp is suitable for all stages of rehabilitation and can be assigned according to each patient's level of deficit from mild to severe. After starting a therapy session, HeadApp adapts the level of difficulty automatically to the patient's performance. It's not necessary to care for the patient all the time. HeadApp leads the patient, instructs, and gives feedback. The patient's progress is automatically tracked and monitored while the clinician is able to deliver services to a greater number of clients, increasing both client treatment efficacy and clinician efficiency. It is important to quickly assess which patients are actually demonstrating cognitive impairment that may be contributing to functional problems. However, cognitive screening tests should not be used as a replacement for comprehensive neuropsychological testing. Screenings are commonly used for the early identification of individuals at potential risk for condition or disorder. They may indicate need for further evaluation or intervention. They are used to monitor progression of symptoms or response to intervention. HeadApp Screening Battery offers 7 clinically validated short cognitive tests and 2 questionnaires. Patients can undergo the full set of tests or perform individual specific tests. The test battery identifies strengths and weaknesses in all cognitive domains, plus functional performance in activities of daily living, mental well-being, and language. If the performance in a test is lower than the average or worse, a suitable therapy battery is automatically suggested. Each screening has its own specific minimum duration corresponding to the respective test goal. The screenings last between 2 to 6 minutes on average. The maximum total length of all screenings is about 45 minutes. The screening results are displayed graphically in a color-coded bar chart. A green bar indicates a normal result, yellow indicates a lower average, a mild deficit, red indicates a moderate to severe deficit. When the patient starts training, a level of difficulty is automatically selected corresponding to the level of performance. If trainings offer special setting options, these are carried out according to the test results. A special feature offers the Pathfinder Visual Spatial Attention Test. This test recognizes also a slowdown on the right or left visual field, which may indicate a visual spatial neglect or hemianopia. Accordingly, some basic training settings for the patient will automatically be modified. If the result is strongly impaired, the optokinetic stimulation is activated additionally. There are 3 parallel variants for each test. Nevertheless, and in accordance with the test theory, an appropriate time should have passed between the tests in order to avoid learning effects. Therefore, the screenings cannot be repeated for monitoring purposes sooner than after 4 weeks. Brain rehabilitation is crucial for restoring and compensating patients' cognitive decline following neurological complications or suffer from psychiatric disorders associated with cognitive deficits. HeadApp is a comprehensive and sophisticated system. This practical tool assists the therapist in the rehabilitation of cognitive disorders. By solving tasks, brain processes will be activated and important brain functions will be improved or restored. Successful training means that the user will be better able to cope with the challenges of everyday life. HeadApp has 5 attention programs on board. A good working attention level is the foundation for all continuing cognitive therapy. A patient may not be able to stay focused on a single task, avoiding distractions, can't move from one task to another very easily, can't do more than one thing at once, and can't process things very quickly. The attention programs address reaction and impulse control, attention and focus, flexibility, spatial attention, and divided attention. Working memory is a critical and limiting factor for cognitive control and executive functions. The functionality of the working memory provides a basis for many higher cognitive functions, such as problem solving, speech comprehension, arithmetic, and intelligence achievements. Accordingly, HeadApp delivers a complete set of working memory programs, with 5 programs including NBAC training, verbal working memory, visual working memory, and Blackjack, adapted to a working memory exercise. Deficits in memory functioning are very common in individuals following acquired neurocognitive impairment, neurodegenerative disease, or associated with psychiatric trauma. 4 memory exercises with HeadApp reinforce internal learning strategies and help to establish compensation techniques. HeadApp's memory trainings address learning and memory strategies, including the method of Loki and the 5-step strategy PQRST. The short-term memory training Flip-It aims to memorize and recall the position of figural and verbal content. 5 modalities are included: image-image, image-word, word-image, word-word, and a mix of all tasks. The third program, Pair It, trains recognizing, remembering, and retrieving of verbal and/or figural content pairs. Additionally, an auditive mode is available. The memory training VitaMem trains semantic, short-term memory, and delayed recall. Many higher-order complex thinking processes happen without us being aware of them, known as automatic processes. Together, many of these processes are known as executive functions. Executive functioning includes all the things that allow us to organize, make decisions, and solve problems. It also involves the way we monitor activities in our surroundings and adjust what we think and do in response to it. Signs for executive functioning disorders are not being able to manage time well, difficulty meeting goals, difficulty determining the amount of time necessary to complete a task, difficulty in organizing and planning, trouble switching focus and shifting between activities, and difficulty prioritizing work or responsibilities. Therapists are provided by 4 exercises with close to everyday life templates in order to train and strengthen time anticipation, logical reasoning, problem solving, and daily activities. Last but not least, HeadApp provides the therapist with 5 language exercise programs to train word usage, sentence structure, language sequences, language reasoning, and word finding and production. Teletherapeutic home training with HeadApp is made easy, flexible, and personalized. HeadApp guarantees greatest flexibility in remote intervention. Via HeadApp's online therapy plan, home-based therapy is prescribed to the patient by the clinician. The therapy prescription is assigned from the clinician's computer and is transferred over the internet to the patient's computer at home at a fingertip. The patient can then launch and complete the training using HeadApp's browser-based patient software version. Completed screening and training results are then available in real time on the clinician's computer for monitoring and therapeutic evaluation. It's made so simple. The only thing you need is any computer, laptop, or tablet and an internet connection. HeadApp's GDPR and HIPAA compliance guarantees data privacy. Now let's turn to the practical handling of HeadApp. I'm going to show you how easy HeadApp is to use. If you have already had a trial and are registered, please log in with the email address and password you used during registration. I use for the demo exampleclinic@headapp.com, use my password and log in. At the beginning, normally your patient list is empty or you have only entered 1 patient during the trial phase. Start by adding additional patients by clicking New and fill in the orange framed fields. I call my demo patient Benny Byrne. It is planned that he will continue his therapy at home with a program selection determined by the therapist. That's why I also enter his email address and give him a login password. Please make a note of your patient's login data immediately in order to give or send it to him or her later. Now I enter his age and select the gender. For documentation purposes, you can still select the type of disease. let's say, traumatic brain injury. For example, you can also use the Setup tab to specify that task instructions are not only presented in writing, but also spoken. I don't use this feature right now for the demonstration. Click Continue, then you will see your patient list. Choose your patient and click Continue. First of all, you will be offered to perform the screening and questionnaires battery with your patient. Performing the screenings is optional. It can also be skipped if you have already completed a neuropsychological assessment. If you skip the screenings, you will be offered by all the programs to choose from. Nevertheless, the screenings are recommended, as HeadApp automatically recommends a deficit-specific training batch based on the results. Of course, this can be supplemented by further training programs according to your specifications. I return to the screenings. Patients can undergo the full suite of tests or perform individual specific tests. In practice, however, patients usually complete all screenings and questionnaires in one session. Due to the limited time, I will show you as an example the working memory screening number sort. To simulate a patient with cognitive impairments, I will solve some task incorrectly. The test task is to remember the present numbers and then click in ascending order from the lowest to the highest number. First I did the correct answer. Now I will do the incorrect answer. Already done. As you can see, the client achieved a percentile rank of 1%. The subject is therefore one of the 1% of the weakest task solvers in the norm group in his gender and age. The cognitive performance is interpreted to be strongly impaired. As you can see on the bottom of the screen, the patients who have done the screening at home can email the screening results to their therapist. However, this is only necessary to indicate to the therapist that the patient has now completed the screening. Regardless of this procedure, the therapist can view the results online at any time. By clicking on Continue, the recommended therapy programs are immediately displayed. In this case, it is the program Memory VitaMem and the working memory program NBAC. If the patient is in your practice or clinic, you can start now immediately with the therapy programs, or the patient starts the training at the next session. As you already know, HeadApp is suitable for both, for use in the clinic or practice and for continuing the patient's therapy at home. This teletherapeutic approach is carried out very simple via the integrated therapy plan. I will show you how does it work. Click on Therapy Plan and a calendar for the next 4 weeks will appear. Fill the calendar for your patient with the appropriate therapy programs. Right hand, you have all exercises available. On the top, you will find the programs recommended by the screenings. They are highlighted in color. Let's say your patient should continue to train the programs recommended by the screenings at home. In addition, he should additionally train his language skills, as you have found that he also suffers from aphasia. You decided he should start to improve his language skills with the word usage program and the sub-program vocabulary. Simply drag and drop these programs into the calendar. Then set the training time to 20 minutes each. Decide that he should continue with the last task, and if necessary, set a break time between the exercises. In case of the language training word usage, you define the start task as a vocabulary. After that, you can click on the first program and you can duplicate the exercises into the next days and also into the next week. To provide your therapy prescriptions to the patient's account, all you have to do is click on Use Plan and Save. Left hand. Use Plan and Save. How it looks like at the patient's end, I will show you right now. I go back and log in with the patient's data. Set the data protection info about GDPR. Agree the terms of use. For legal reasons this is necessary. And click Continue. The patient is now shown the first predefined training program. After he has trained it for 20 minutes, The 5-minute break follows, and he is then shown the second predefined program for the start. After another 20 minutes of training, the third program follows. As an example, I will show you this program. Cards are shown one after the other. The patient has to memorize the card just shown. When two identical cards are shown consecutively, he has to click or tap it or press the spacebar. When an answer was correct, he will be awarded by collecting stars. If he has successfully completed a level, he automatically switches to a more demanding level. Give the correct answer and get my stars. Give a correct answer, my stars will be reduced and a wrong message appears. Okay, that's enough for the moment. I go back and leave the training. The training results are automatically transferred in real time to your therapist account, and you can view them at any time. To do this, click on Results and you will find different views. In our example, of course, there is still very little to see. Another important note, let me go back. To leave the therapy plan mode of your patient to get back to the start view with all programs, please click on Therapy Plan again. Take out the check mark, Use Plan, and click Save. Now you are back in the standard mode and can see all the training modules available and see all screen recommendations. Thank you very much. I hope you like the clear structure and the very easy handling of HeadApp. In summary, what are the advantages and benefits? HeadApp is a web-based application and can be used on any internet-enabled computer or tablet, inclusive Mac and Windows PC, laptop, iPad and Android tablet. No install process needed. HeadApp is an all-in-one solution for clinics, practices, rehabilitation centers, mobile use and in-home rehabilitation via internet. HeadApp allows to treat patients regardless of where they are, and you can add an unlimited number of patients. It's a comprehensive program that covers common cognitive deficits plus language. HeadApp is suitable for all stages of therapy and rehabilitation. HeadApp can be assigned according to each patient's level of deficit, from severe to mild. The system adapts the level of difficulty automatically to the patient's performance. Each program can be personalized to specific needs. HeadApp leads the patient, instructs and gives feedback. The instructions are available written and spoken. The content is motivating and rich in variety with more than 30,000 pictures. The system offers content close to daily living and the progress is automatically tracked and monitored. HeadApp is evidence-based and clinically proven with a track record of 30 years. And finally, is GDPR and HIPAA compliant. Thank you very much for your time and your attention. For further information, please visit our website and get started today with a free trial for 14 days. Thanks a lot.